is Caitlin Garcia, and I would like to start this presentation by asking you a couple of questions. First, how far do you think we should go in editing our genes? And have you heard of gene therapy? So I'd like to start off by explaining what gene therapy is. Gene therapy is an approach for correcting or replacing an undesirable or non-functional gene in a cell. Today, my main points that I will be discussing include the use of CRISPR, success stories of gene therapy, the ethical implications of it, and the accessibility of it. First off, I'd like to discuss CRISPR, which is one of the most promising tools for treating human genetic diseases. It is an editing tool that has been used to treat many different types of genetic diseases, such as cardiovascular diseases, neural disorders, and cancers. Gene therapy uses technologies like CRISPR to correct and remove certain genes in order to target the root cause of a certain genetic disease. This is very significant because in modern medicine, medications are used to manage symptoms. While this technology holds a lot of potential for one day curing diseases, it brings up a lot of ethical concerns. CRISPR can also be used for screening, monitoring, and regulating genes. It doesn't have to just alter genes. Next, there are a lot of success stories regarding the use of CRISPR and gene therapy. For example, in sickle cell disease, there are a lot of gene therapies that are getting approved. There's a couple that have actually been approved by the FDA very recently in December of 2023. So, if you don't know, sickle cell disease is a hereditary blood disorder that can be debilitating and even life-threatening, as it causes abnormal hemoglobin polymerization. So, two treatments, called Casgevy and Lyfgenia, are the first cell-based gene therapies for the treatment of sickle cell disease in patients that are 12 years and older. It is FDA approved and one of the first FDA approved gene therapies. Both of these treatments are made from the patient's own blood stem cells, which are then modified and given back to the patient one at a time. According to the FDA, 100,000 people in the U.S. have sickle cell disease. Regarding the treatments the FDA approved, 93.5% of patients experienced freedom from severe vascular occlusive crises for at least 12 consecutive months using Casgevy, and 88% of patients achieved complete resolution of vaso-occlusive events within 6 to 18 months post-infusion using Lyfgenia. These treatments provide a lot of hope, not only for those with sickle cell disease, but also those who suffer from hereditary diseases as well. Now I'd like to discuss the ethical implications of using gene therapies. First, I'd like to talk about gene therapy versus genetic enhancement. Gene therapy aims to improve faulty genes, while genetic enhancement wants to improve genes that aren't faulty but are normal. And this is a big debate in gene therapy and what people think gene therapy is used for, because a lot of gene therapy is known for changing a baby's eye color or hair color, but it can also be used to help treat genetic diseases. There's also a debate on whether it should be used on somatic cells that cannot be passed down versus germline cells that can be passed down. There are still many opinions on the ethics of uses of genetic editing technologies, but there are also debates on accessibility. Accessibility is another very important topic in regards to gene editing. Firstly, legislation on gene editing varies among different countries. Some impose barriers when it comes to the uses of gene editing technologies like CRISPR. This can also create a barrier in research. Another big impact on accessibility is cost and treatment, and whether it is affordable and efficient. According to a study published in June 2024, a cost-effective analysis was done to assess the long-term value of FDA-approved gene therapies like the one used for sickle cell disease. This study revealed that despite very high treatment costs, a lot of these products were considered cost-effective. Even though they had a higher cost up front, over time their cost was less, as these treatments would not be needed over a long period of time, like modern treatments. Now, having all of this information on both the science and ethical aspects of gene editing and real-world uses, do you think using genetic engineering takes things too far? And how far would you go? Thank you.